Ted Wilson and his son Todd have more than a father-son relationship in common. They both have gone through hip replacement surgery.
I had a motorcycle accident many years ago, an 18-wheeler, and I had a collision on the roadway, and it put me down for about a year. And it damaged the whole right side of my body, and that's where the first problem with the hip came.
Todd was in law enforcement, and a decade of regular physical training took its toll on his damaged hip until painkillers weren't helping, and he needed a solution. For his father, his hip problem wasn't due to an accident, but arthritis.
When I would move, it was very bad, and I would have to take my time getting up, sitting down, getting into bed, getting out of the bed. I would have to really take my time because, and sometimes, a lot of times, my wife had to help me get in and out of the bed.
Both Todd and Ted opted for hip replacement surgery, an anterior approach that got them back on their feet a lot faster.
This table is called the arch table. All it allows us to do, it helps facilitate the approach. There's certain positions you have to put the leg in to make the exposure a little easier, and that's what this table allows us to do. With an anterior approach, what we're doing is we're going between muscle layers, spreading them between those natural layers and getting access to the joint, allowing us to do the surgery.
Got up that afternoon, walked, the physical therapist came in, put us through some drills. The next morning came back in, said if we could walk some stairs I could go home, so we got up and walked stairs in the stairwell outside, and I went home at lunch the next day after surgery.
The first day out of surgery, that afternoon, they got me up. And you know, at that point in time, I knew I had something I could build on.
I do think there's some potential benefit to it. I would say anecdotally, people do seem to do better. They seem to get their gait more natural early on without limping. They do seem to have less pain.
Knee replacements are another joint replacement surgery offered by Dr. Armacida.
For a medial unicompartmental arthroplasty, which is a partial knee replacement, just replacing the inside, the medial aspect of the knee, those folks have a specific type of wear pattern. It is osteoarthritis.
Osteoarthritis means pain, plain and simple, but it takes a certain type of arthritis and a thorough assessment to be a candidate for partial knee replacement.
I'd say the majority of folks are in their late 50s and their 60s and up, just enough time to put some wear and tear on their joints. And it all depends on their wear pattern, the competency of their ACL, to a certain extent how much deformity they have, and the condition of their patellofemoral joint. And if folks meet that criteria and they're not an inflammatory arthritis, like a rheumatoid arthritis, a psoriatic arthritis, then they would be a candidate for partial knee replacements.
The result of joint replacement surgery for many patients is not just a new joint, but the elimination of pain and the return to activities and a normal life.
Time to do joint replacement is when folks are afflicted with osteoarthritis and the things that we have at our disposal short of surgery aren't working for you. Everybody's a little different. Some folks, the pain affects them. Their pain is severe for them that the things that they want to do, they can't do.
Right now, I have no pain now. Like standing here, I have no pain. And when, just back in December, 4.5, 5 months ago, I couldn't do this. So, I mean, it's made a tremendous difference, and I'm looking for the same quality of life I had before I started having pain, 15 years ago. So that's what I want to do, is just get back to just a normal, everyday part of life of being able to move without any pain, and I'm almost there now.
Advanced orthopedic surgery, compassionate care, from the surgeons at Spartanburg Regional Healthcare System.